Protein rice benefits for diabetes. Hello everyone. Today we have Dr. Muddu Surendra Nehru, MD, joining us to discuss an exciting development in diabetic nutrition, protein rice. Dr. Nehru, thank you for being here.
Thank you for having me. I'm excited to share this important information about protein rice and how it can help people with diabetes. What is protein rice?
Dr. Nehru, let's start with the basics. What exactly is protein rice?
Protein rice is a specially developed variety of rice that contains significantly higher protein content than regular white rice. There are two main types. First, commercially enriched protein rice, like the lean co, high protein rice, which contains around 48% protein by adding plant sources like soybean and wheat protein. Second, scientifically developed varieties using advanced breeding and gene editing technology. These naturally contain double the protein of conventional rice. Varieties like HOP rice from the International Rice Research Institute or Indian varieties like Dhan 310. What makes these special is they also have an ultra-low glycemic index, below 45, compared to white rice, which is around 70-90. That's fascinating. How exactly does protein rice help people with diabetes? Excellent question. Protein rice benefits diabetics in several key ways. Number one, lower glycemic response. Clinical studies from 2016 showed that when rice is consumed with protein-rich foods like soya, it significantly lowers post-meal blood sugar spikes. The protein slows down the digestion and absorption of carbohydrates. Number two, better blood sugar control. A 2022 clinical trial with type 2 diabetic patients proved that high-protein, high-resistant starch rice reduced postprandial glucose levels and glycemic variability compared to ordinary rice. Number 3. The science. These high-protein rice varieties work at the genetic level. Scientists modified a gene called SBIIB using CRISPR technology. This increased amylose content by 8% and reduced the glycemic index by 60%. This means glucose is released much more slowly into your bloodstream. Number 4. Better nutrition. High-protein rice contains more essential amino acids like lysine, histidine, and methionine, nutrients often lacking in regular rice. This provides better overall nutrition for diabetic patients. Are there benefits beyond diabetes management? Absolutely. Protein rice offers multiple health advantages. For weight management, higher protein content increases satiety, helping you feel full longer and potentially reducing overall calorie intake. For muscle health, the increased protein supports muscle maintenance and repair, especially important for elderly diabetics or those trying to build muscle. Heart health. The bioactive compounds in rice bran, like gamma-oryzanol, ferulic acid, and vitamin E, have protective effects for cardiovascular health. For digestive health, the higher resistant starch content acts like fiber, promoting healthy gut bacteria and improved digestion. Digestive health. The higher resistant starch content acts like fiber, promoting healthy gut bacteria and improved digestion. So it's not just for diabetics. Athletes, fitness enthusiasts, elderly people, and anyone seeking better nutrition can benefit. How it helps diabetes. Dr. Nehru, what practical advice would you give to someone wanting to switch to protein rice? Here are my recommendations. Choose the right type. Look for whole grain varieties. Brown rice, wild rice, basmati, or specifically labeled high-protein rice like the lean co or Cahokia rice, which has 60% more protein than typical rice. Combine strategically. Even with regular rice, combine it with lean proteins like fish, chicken, tofu, or legumes, plus healthy fats like nuts or olive oil. This combination naturally lowers the glycemic response. Watch portion sizes. Even protein rice contains carbohydrates. A reasonable portion is about half to 3/4 of a cup cooked rice per meal. Monitor your blood sugar to find what works for you. Avoid processing. Skip fried rice or heavily processed rice dishes. Simple steaming or boiling preserves the nutritional benefits. Monitor your response. Everyone's body responds differently. Check your blood sugar levels after meals to see how protein rice affects you personally. Who would benefit most from protein rice? Protein rice is particularly beneficial for Type 2 diabetics looking to improve blood sugar control, pre-diabetics wanting to prevent progression to diabetes, people at high risk, those with family history or metabolic syndrome, fitness enthusiasts needing higher protein intake, elderly individuals requiring better protein nutrition, weight management seekers wanting to feel fuller longer. However, people with kidney disease should consult their doctor first, as higher protein intake may need monitoring in certain kidney conditions. Are there any safety concerns people should know about? Good question. For commercially available protein rice made with plant proteins, there are minimal concerns, just standard food safety. For gene-edited varieties, the scientific consensus is that they're safe. In India, varieties like Pusa rice and DRR Dhan 100 have been approved after biosafety evaluations. They use CRISPR technology without inserting foreign DNA. That said, some concerns exist about long-term effects and ecological impacts. Both India and the EU have regulatory frameworks to ensure safety. For most people, protein rice, whether commercial or scientifically developed, is a safe, beneficial option. Always consult your healthcare provider when making significant dietary changes, especially if you have diabetes or other health conditions. Dr. Nehru, any final thoughts? Protein rice represents an exciting advancement in diabetic nutrition. The clinical evidence is clear. It helps control blood sugar, reduces post-meal glucose spikes, and provides better overall nutrition. Whether you choose commercially available high-protein rice or wait for the newer gene-edited varieties to become widely available, the key message is this: combining rice with protein improves glycemic control. Start by adding more protein to your rice meals today and consider switching to high-protein rice varieties as they become available in your area. Additional health benefits. Remember, diabetes management is a comprehensive approach involving diet, exercise, medication, and regular monitoring. Protein rice is one powerful tool in your nutritional toolkit. Thank you so much, Dr. Nehru, for this valuable information. My pleasure. Stay healthy, everyone. Text on screen. Subscribe for more health tips. Consult your doctor before dietary changes. Like and share if you found this helpful. Who should use it? 5:15 to 6 ARC. Safety and considerations 6:45. Conclusion 6:45 7:30. End screen 7:30 7:45.